The defining moment for me was when I was hiking Mount Si, and it took me twice as long to come down than it did to go up. I realized then that I needed to start thinking about having a knee replacement. Quality of life was not what I wanted it to be for the rest of my life, and I had to make that decision. My experience at Valley Medical Joint Center was fabulous. The nurses were great. Each shift, they were there when I needed them. They answered questions. My sister was my caretaker since my husband was in Afghanistan, so she was allowed to stay with me that night, and actually all 3 nights. And they were fabulous. I could not believe how professional and gracious, and it was a wonderful experience. Now I can hike without pain. Everything I do now, skiing, hiking, walking, riding my bike, little kayaking, everything is so much better. I'm not afraid anymore to go out thinking I can't keep up with Bob or I can't keep up with my friends if we go. As I get older, I know things are going to break down, but to be able to do some of the stuff I used to do is just remarkable, and I'm ecstatic over it. I love it. Dr. Barrett will tell you that what he does is only like 10%. It's important, but you own your recovery. I can't express that enough, is that once the surgery's done, it's up to you to make sure you do your exercises 3 times a day, that you go to physical therapy, that you do what your physical therapist tells you to do. If you do that, it will be successful. I knew that from past experience that I had to follow those instructions, and I committed myself to doing everything they told me to do, and I am so happy I did. The most important thing I can give you, the most important advice, is to make sure you follow the instructions of your physical therapy and keep going as long as you can.